When we think about the end of life, especially for an elderly loved one, many of us imagine it as a sudden event, a moment that arrives without warning. However, the truth is far more gradual. The body often begins sending quiet signals months or even a full year before life reaches its final stage. These signs are easy to miss because they seem small at first, often mistaken for the normal effects of aging. It's only when we look back after a loved one has passed that we realize the clues were there all along. By then, it's often too late to prepare, too late to have those meaningful conversations or to make memories that could have brought comfort and closure. The good news is that by learning to recognize these signs early, you can make a difference. Understanding these subtle changes gives you the opportunity to provide better care, cherish precious moments, and ensure your loved one's final months are filled with love, dignity, and peace. In this guide, we'll explore 5 key signs that often appear in the year leading up to an elderly person's passing. Some may seem familiar, perhaps changes you've noticed but dismissed as just aging. Others might surprise you with their significance. By the end, you'll have a clearer understanding of what to watch for and how to respond so you can make the most of the time you have left with those you love. Let's begin. 1. Unintentional weight loss. A silent warning. One of the earliest and most telling signs that an elderly person may be approaching the final year of their life is unintentional weight loss. At first, it might seem minor, a belt that suddenly needs an extra notch, clothes that hang a little looser, or a face that appears thinner. Many families brush this off, assuming it's a natural part of growing older. After all, metabolism slows with age, and some muscle loss is expected. But when weight loss happens without effort or intent, it's rarely a positive sign. It's often the body's way of signaling that something deeper is happening. This kind of weight loss is different from deliberate dieting or temporary appetite changes. It's persistent and progressive, often accompanied by a noticeable decline in strength and energy. For example, you might notice your loved one struggling to carry groceries they once handled easily or needing help to stand up from a chair. These changes stem from the body's reduced ability to absorb and process nutrients efficiently. As organ systems slow down, digestion becomes less effective, and the body struggles to convert food into energy or maintain muscle mass. There are several reasons why this happens. First, muscle wasting, known as sarcopenia, accelerates in the final stages of life. The body may not process proteins as effectively, leading to a gradual loss of muscle tissue. This not only weakens the person physically, but also increases their risk of falls and injuries as their body becomes less stable. A fall that might have been minor in the past could now lead to serious complications like fractures or infections because the body is less resilient. Another key factor is a change in appetite. Many elderly individuals simply don't feel hungry the way they used to. Their sense of taste and smell, which play a big role in making food appealing, often fade with age. Foods they once loved might no longer seem enjoyable, leading them to skip meals or eat much smaller portions. For instance, a favorite dish like homemade spaghetti might be left untouched, or they might pick at their plate claiming they're just not hungry. This isn't just a matter of preference, it's a physiological shift. As the body begins to shut down, it sends fewer signals to the brain to seek food, resulting in reduced caloric intake and, over time, significant weight loss. Underlying medical conditions can also drive this process. Chronic diseases like cancer, heart failure, kidney disease, or even undiagnosed conditions can cause weight loss long before other symptoms become obvious. For example, cancer often leads to a condition called cachexia, where the body wastes away despite adequate food intake. Similarly, heart or kidney issues can disrupt the body's ability to process nutrients, leading to a gradual decline. Even psychological conditions like depression or early cognitive decline can reduce appetite, creating a downward spiral where the body lacks the fuel it needs to function. For families, watching a loved one lose weight can be concerning, and it's natural to want to intervene. You might try cooking their favorite meals, offering high-calorie snacks, or encouraging protein shakes to boost nutrition. While these efforts come from love, they may not always reverse the trend. If the weight loss continues despite your best efforts, it's a sign that the issue goes beyond diet. The body is preparing for a deeper transition, conserving energy for essential functions rather than building strength. Instead of focusing on forcing food, shift your approach to comfort. Offer small, easy-to-eat meals. Think soft foods like soups, smoothies, or mashed potatoes that are gentle on the stomach. Ensure they stay hydrated, as dehydration can worsen weakness and confusion. If your loved one is losing weight, eating less, or seems weaker than before, pay attention. This isn't just about physical appearance, it's about the body sending a message. Recognizing this sign early allows you to adjust your care consult with healthcare providers and focus on making every moment meaningful. By doing so, you can help your loved one feel supported and cared for during this delicate time. 2. Extreme fatigue and weakness. When energy fades, another hallmark of the final year of life is a deep, persistent fatigue that doesn't improve with rest. This isn't the kind of tiredness you feel after a busy day or a poor night's sleep. It's a profound exhaustion that makes even the simplest tasks feel insurmountable. Getting out of bed might take all their effort. Walking across a room could leave them breathless. Even holding a conversation or eating a meal might feel like running a marathon. For families, this change can be alarming, especially if your loved one was once active and independent. This fatigue stems from the body's gradual decline in function. As we age, organ systems like the heart and lungs work less efficiently. The heart may not pump blood as strongly, reducing oxygen delivery to muscles and tissues. This leads to weakness, unsteadiness, and a sense of heaviness that makes movement difficult. You might notice your loved one needing to sit down after minimal activity, like walking to the kitchen, or they may rely more on mobility aids like canes or walkers. These changes are a sign that the body is conserving its limited energy, prioritizing vital functions like breathing and circulation over physical activity. Metabolic changes also play a role. The body naturally slows its energy production as it nears the end of life. Instead of fueling movement or activity, energy is redirected to maintain essential processes. This is why many elderly individuals in their final months sleep more, take longer naps, or struggle to stay awake for extended periods. You might notice sudden energy drops, moments where they seem alert and engaged 1 minute, then completely drained the next. These fluctuations are normal as the body adjusts to its declining capacity. The emotional toll of this fatigue can be just as significant. For many seniors, independence is a source of pride. When they can no longer do the things they once enjoyed, like gardening, cooking, or even chatting with friends, they may feel frustrated, embarrassed, or even ashamed. This can lead to emotional withdrawal, where they stop engaging in conversations or activities, not because they don't care, but because they simply don't have the energy. For example, a grandparent who once loved telling stories at family gatherings might now sit quietly staring out the window, unable to muster the strength to participate. For families, this withdrawal can feel like a personal loss. It's easy to misinterpret it as disinterest or assume they just need to try harder. But pushing them to be active or social can lead to frustration for both of you. Instead, respect their need for rest. Create a calm, supportive environment where they feel safe to relax. Simple gestures like sitting quietly together, playing soft music, or holding their hand can provide comfort without demanding energy they don't have. If you notice your loved one struggling with deep fatigue, weakness, or withdrawal, take it as a sign their body is entering a new phase. This is a time to focus on quality over quantity. Instead of encouraging them to push through exhaustion, help them conserve energy for moments that matter, like sharing a laugh or reminiscing about cherished memories. By understanding their limits, you can make their final months more peaceful and meaningful, ensuring they feel loved and supported every step of the way. 3. Cognitive decline or emotional withdrawal, a shift in mind and spirit. As the body approaches its final stage, the mind often begins to show signs of change as well. One of the most striking indicators is cognitive decline. A loved one who was once sharp, witty, and engaged might start forgetting things more frequently, names, dates, or even where they are. They may struggle to follow conversations, repeat themselves, or seem disoriented in familiar places like their own home. These changes can begin subtly months or even a year before the end, and they're often mistaken for normal aging or early dementia. However, they signal a deeper shift. The brain, like any organ, relies on a steady supply of oxygen and nutrients to function properly. As circulation weakens and blood flow to the brain decreases, cognitive abilities start to falter. This can manifest as difficulty making decisions, trouble recognizing familiar faces, or moments of confusion that come and go. For example, your loved one might ask the same question repeatedly during a conversation, or seem unsure about how to perform a routine task like making a cup of tea. In some cases, They may have brief moments of clarity followed by sudden confusion, as if their mind is flickering in and out. Emotional withdrawal is another common sign. Many elderly individuals nearing the end of life become less interested in social interactions. They may speak less, avoid gatherings, or spend long periods sitting in silence, seemingly lost in thought. This isn't because they've lost their love for family or friends. It's because their brain struggles to process emotions and engagement. Conversations become exhausting and noisy, or busy environments like a family dinner can feel overwhelming. As a result, they may retreat into their own world, preferring solitude or quiet. Mood changes are also common. Some individuals become more irritable, anxious, or easily frustrated, especially if they're aware of their cognitive struggles. Others may seem unusually calm, detached, or indifferent to things that once mattered deeply, like a favorite hobby or family milestone. These shifts aren't a reflection of their personality, but a result of the brain adjusting to the body's decline. The emotional centers of the brain may not process feelings as vividly, making it harder for them to express joy, sadness, or excitement. For families, these changes can be deeply painful. Watching a loved one lose their mental sharpness or pull away emotionally can feel like losing them before they're physically gone. It's tempting to try to draw them back into conversations or push them to engage, but this can lead to frustration or agitation. Instead, meet them where they are. Use simple, gentle communication, short sentences, familiar topics, and a soothing tone. Even if they don't respond, your presence can provide comfort. For instance, sitting together to look at old photos or listening to their favorite music can create connection without demanding mental effort. If you notice increased forgetfulness, confusion, or emotional distance, don't dismiss it as just aging. These are signs the body and mind are preparing for the final transition. Use this time to create a safe, familiar environment. Avoid overwhelming them with complex decisions or crowded settings. Instead, focus on small, meaningful moments, holding their hand, sharing a quiet smile, or simply being present. These acts of love can bridge the gap even when words and memories fade. 4. Frequent infections and slow healing. A weakening defense. As the body nears the end of life, one of the clearest physical signs is a weakened immune system. An elderly person who rarely got sick in the past may now seem to catch every cold, flu, or infection that circulates. What's more, these illnesses linger longer than they used to, and recovery feels incomplete. Simple wounds like a small cut, scrape, or bruise take weeks to heal or may not heal at all. These changes aren't random. They reflect the body's declining ability to defend and repair itself. Frequent infections such as pneumonia, urinary tract infections, UTIs, skin infections, or even oral infections become more common in the final year. For example, a minor cough might turn into recurring pneumonia, or a simple UTI might require multiple rounds of antibiotics. In the past, these illnesses might have resolved quickly, but now they persist, and the person may need stronger medications or longer treatment periods. This happens because the immune system is less effective, and circulation is compromised, reducing the body's ability to deliver oxygen and nutrients to fight infection. Chronic wounds are another concern, especially for those with limited mobility. Poor blood flow means that even small scratches or pressure sores heal slowly, if at all. For bedbound or less active individuals, pressure sores, also called bed sores, can develop on areas like the hips, back, or heels, and these can quickly become infected if not carefully managed. Families might notice that a bruise lingers for weeks or a small cut reopens repeatedly, signaling that the body's repair mechanisms are faltering. Infections in the elderly often don't present with typical symptoms like high fever. Instead, you might notice subtle changes like increased tiredness, confusion, or a sudden drop in appetite. For instance, a grandparent who seems unusually lethargic or disoriented might be fighting an infection even without a fever. This is why paying attention to these less obvious signs is critical. They can be the first clue that something is wrong. Families often feel frustrated or helpless, watching their loved one go through repeated illnesses. It's natural to push for aggressive treatments, hoping that one more round of antibiotics or a hospital stay will fix the problem. However, when infections become frequent or healing slows significantly, it's often a sign that the body is nearing its limits. At this stage, the focus often shifts from curing to comforting. Keeping the person hydrated, ensuring their skin is clean and moisturized, and minimizing stress on their body can do more for their well-being than prolonged medical interventions. If you notice your loved one experiencing frequent infections or slow healing wounds, take it as a sign that their body is weakening. Consult with healthcare providers to manage symptoms, but also prioritize comfort measures. Simple steps like using soft bedding to prevent sores, offering fluids regularly, or keeping their environment clean can make a big difference. By recognizing these signs early, you can help ensure their final months are as comfortable and dignified as possible. 5. Changes in breathing and circulation. The body's final signals. One of the most profound signs that an elderly person is nearing the end of life is a change in breathing patterns and circulation. These changes can be subtle at first, but become more noticeable over time. You might observe that your loved one breathes more slowly or shallowly than before. Their breaths may become irregular with pauses or sudden shifts in rhythm. Some experience a pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes signal that the body is conserving energy and prioritizing essential functions. Circulation changes are equally significant. You may notice that your loved one's hands, feet, or even their nose and ears feel cold to the touch. Their skin might appear pale bluish or mottled, especially around the fingers, toes, or lips. This happens because the heart is pumping less effectively, reducing blood flow to the extremities as the body prioritizes vital organs like the heart and brain. For example, you might notice their hands feel icy even in a warm room, or their fingertips take on a bluish tint. Shortness of breath is another common symptom. Even minimal activity like sitting up, talking, or shifting positions can leave them winded. They may breathe through their mouth more often or need to pause to catch their breath during a conversation. In some cases, fluid buildup in the lungs can cause a persistent cough, gurgling sounds, or a feeling of tightness in the chest. This can make lying flat uncomfortable, leading many to prefer sleeping propped up on pillows or in a recliner to ease breathing. For families, these changes can be frightening. Seeing a loved one struggle to breathe or noticing their cold hands can trigger a sense of urgency, prompting calls to doctors or trips to the hospital. While medical interventions like oxygen therapy or medications can sometimes help, these changes often reflect the body's natural process of slowing down. Instead of focusing solely on reversing these symptoms, prioritize comfort. Keep the room cool and well ventilated, use a humidifier to ease breathing, and offer small sips of water to prevent dryness. Simple acts like adjusting pillows to support their position can make a big difference. If you observe changes in breathing, cold extremities, or a bluish tint to the skin, recognize these as signs that the body is preparing for its final stage. This is a time to be present, offer gentle reassurance, and create a peaceful environment. Speak softly, hold their hand, or play calming music to help them feel safe. While these moments can be emotional, they're also an opportunity to show love and ensure your loved one feels supported as they near the end. Final thoughts: embracing the journey with love and understanding. As we conclude this guide, let's reflect on the 5 signs we've explored: unintentional weight loss, extreme fatigue and weakness, cognitive decline, or emotional withdrawal, frequent infections and slow healing, and changes in breathing and circulation. These signs, though subtle, are powerful indicators that an elderly loved one may be in their final year of life. They may not all appear at once, and their progression varies from person to person. But when you start noticing these changes, it's a call to pay attention, not with fear, but with compassion and purpose. For many families, accepting these signs is challenging. It's natural to want to fight against decline, to encourage your loved one to eat more, stay active, or snap out of confusion. But sometimes the most loving act is to listen to what their body's telling you. Instead of trying to reverse the inevitable, focus on creating moments of connection and comfort. Share stories, laugh over old memories, or simply sit together in silence. These small acts can bring immense peace to both you and your loved one. Understanding these signs isn't about preparing for loss, it's about preparing for presence. By recognizing the body's signals, you can make informed decisions, seek appropriate care, and ensure your loved one's final months are filled with dignity and love. You can advocate for their comfort, whether that means adjusting their environment, consulting with hospice care, or simply being there to hold their hand. This knowledge empowers you to make every moment count, creating memories that will stay with you long after they're gone. If you're noticing these signs in someone you love, know that you're not alone. Countless families have walked this path, and while it's never easy, it's a journey that can be filled with meaning. Take a deep breath. Lean on support systems like family friends or professionals and focus on what matters most, ensuring your loved one feels valued, understood, and cherished. Thank you for taking the time to learn about these important signs. If this guide has resonated with you, consider sharing one thing you've learned and how you plan to use it. Your insights can inspire others and help us continue creating content that informs and supports. For more resources on caring for loved ones in their final stages, subscribe and stay connected. Together we can navigate this journey with compassion, strength, and love.